Good afternoon, everyone, and welcome to Ask a Doctor. I'm Denise Koch. I'm delighted to have you with us. And today we have Dr. Pallavi Kumar, Senior Physician and Executive Oncology Service Line, Division Director, Medical Oncology, the Alvin and Lois Lapidus Cancer Institute. Thank you for joining us, Dr. Kumar. Delighted to have you. We're going to talk today about the brand new Mandy and Dennis Weinman Center building and the new sort of interesting multidisciplinary approach that this center is going to house. If you've driven by the Sinai campus, I don't know who's listening to us today and if you've been near Sinai, but it's a brand new, incredible building. Once again, the title, the Mandy and Dennis Weinman Cancer Building. Donated, I'm sure, by the generosity of the Weinman family and trust. So let's first just talk about the building itself. Why was it important that this building be built? And in what way is it different? And in what way will it service you that makes it unique, Dr. Kumar?
Well, thank you so much for having me today. I think everyone should know how excited we are about this new building. The Mandy and Dennis Weinman Cancer Building is on the campus of Sinai Hospital of Baltimore. We have actually expanded access to comprehensive outpatient oncology services for patients of all ages in one centralized location. Traditionally, patients have to actually travel between buildings to get to labs, appointments, and infusions, and to actually meet specialists all over the place. So now we've actually brought all of these services together in one location. We can have patients actually meet their medical oncologist, radiation oncologist, and surgeons all at one visit if necessary. This will actually allow patients to spend less time sort of navigating to every appointment, but really just focus on their healing. I also have to add that this building was designed to really reduce stress. The building reflects what our patients and families shared with us. The spaces are calm, open, filled with natural light. They have floor-to-ceiling windows with views of the Silborn Arboretum. And really, the beautiful artwork throughout the building was thoughtfully chosen. So every detail supports comfort, dignity, and healing.
Sounds wonderful. It also includes surgical centers as well?
So there is a minor procedure room, so the surgeons can do some minor procedures for the patients. And so in some situations, when we're actually examining the patients, we can actually transition them if there was a need.
Wow. I was really intrigued when you said patients of all ages. So you're talking pediatric cancer patients as well.
Yes. So the pediatric hematology oncology group is joining us in this building, as well as adult hematology oncology.
Wow. And is it open now? Is it actually functioning now?
Yes. So the building is opened. We had the first patients enter July 10th. But prior to that, radiation oncology patients were utilizing the building about a month before. So we are in full service.
Wow. So that's the building, which sounds beautiful. Let's talk about this multidisciplinary approach. What does that mean?
So multidisciplinary care is really approaching the patient in such a way that we surround them with many physicians for one diagnosis. So for me, our greatest strength is as an oncology team is that we work together inside this building. Cancer diagnosis and treatment is very complex and, as many know, very overwhelming. So we feel that a team of experts seeing the patients provides direction, reassurance, and a definitive plan. So we bring in all the physicians, nurses, pharmacy, genetic counselors, social workers, nutritionists, wellness and survivorship nursing, rehab, clinical trial, research teams together. We have access to all of this. So our team will collaborate closely to develop one personalized treatment plan that is based on the latest evidence and tailored to each individual goals and needs. So this approach is very streamlined, and in one visit, the patient meets the team and has a plan in place.
And you said social workers, so I assume that means psychological support and comfort as well.
Yes. So usually in our multi-D setting, you'll often meet the medical oncologist, the radiation oncologist, and surgeon. But we have access to all of those other services so that if we need to bring them in, they're located in this building.
And when the patient meets with this team, is the family able to be involved as well if they need the support?
Absolutely. So it's not just about, as we all know, about just the patients. The families need our support as well. So all of the services we have are also available for the patients and their families.
And what about, I understand there are survivorship programs. I'm not sure I understand what that means. Supportive services, clearly you've defined for us, but what is survivorship programs?
So, quite frankly, cancer care extends beyond treating the disease. So, we know cancer affects every aspect of a person's life. It affects their physical health, their emotional health, their well-being overall, their families. It's just their entire future is impacted, as you know. So, one of our missions has been sort of this survivorship program, and it's actually called the Michael J. Schultz Survivorship Program, and we're really proud. The patients will not only know their definitive treatment plans, but at the time of diagnosis, will be focusing on nutritional counseling, financial support and planning, psychosocial services, healing therapies like yoga, massage, acupuncture. And many of the rehab services are through the Rehab Institute at Sinai.
Wow, that's a lot, and
Yeah,
that's very impressive. So, in other words, if you think they can benefit from something like acupuncture
yeah,
or massage or meditation, it's not that it's in that building, but you will then be able to help them guide where they can go in
yeah.
Sinai to get that.
Yeah, so what's really exciting is that we'll be hiring and actually hired a nurse navigator that their expertise is wellness and survivorship. She'll be starting with us very soon. And she's actually going to be part of guiding the patient. So, as patients meet with me, for example, simultaneously at the time of diagnosis, we'll meet the wellness survivorship nurse navigator so that they can also navigate down that path to sort of focus on their body, their spirit, their emotional well-being. So I think this is a great added service to every patient, caretaker, and family.
Yeah, now I understand multidisciplinary. Um, and you're really describing something that takes in every aspect of the patient. It's the diagnosis, I think, most feared by people.
Yes.
It's the word nobody ever wants to hear. We say that that's a cliche because I think it's true. Telling someone they have high blood pressure or that sort of thing is one thing. But when you tell them they have cancer, they immediately feel that their life is at risk. So
Yeah.
if there's somebody who gets that diagnosis, what would you want them to know?
Well, I think you're absolutely right. The diagnosis is overwhelming, but I can tell you the unknown is so scary. So, I think quickly getting into our team, we want the patients and families to know that they're just not alone. A cancer diagnosis is just so scary to our patients, but from the beginning, there is an entire team alongside each of these patients. So, for example, in medical oncology, we surround them with a physician, an advanced practice provider like a nurse practitioner, a nurse navigator, and a medical assistant. So patients can really expect compassionate, personalized, and evidence-based care. And we want every patient to know that there's hope. Our vision really has been to be recognized regionally for our commitment to compassionate, innovative, comprehensive care that reduces disparities and the burdens of cancer in this community. This is truly our goal. So in the end, we really hope that this center will be the light for every patient, every family, and really every member of this community.
Was there a need for this building? I mean, it's obviously going to be a great gift to those who are diagnosed, but did you see a need for this kind of space when it was initially put out as an idea?
Well, I think the need is bringing the physicians and the staff and the nurses all together. And so I think that's what's really the important focus is to surround each patient and offer them cutting edge sort of treatments. I think the building is just so generously donated and given by so many people. And I think just bringing us all together in sort of this open space where you really have light coming in just adds to the comfort for our patients. So I do think patients can get great care from their team in any space, but this added sort of pathway for the patients just gives them so much comfort, healing, and really literally, like I said, light, and which translates to hope.
Yeah, hope is the word. I think people hang on.
Yeah,
Where there is hope, there is life, and where
yeah,
there is life, there is hope.
yeah.
Um, the numbers are getting better, aren't they? There is reason to be hopeful if you get a diagnosis. There are new treatments every day. There are new discoveries every day. It's realistic to be hopeful.
100%. I think there's so many reasons to be hopeful. One is that patients are taking ownership for their health. I think they're screening their, uh, bodies and following up much more than we used to. I think the younger generation is taking care of themselves. I think that's one. I think the second thing is in even my lifetime, I've actually seen patients be cured of cancers that were detrimental. I always bring up the example of melanoma, where if it spread to other organs, we were only having chemotherapy as an option. And then in 2011, we had newer drugs that we were able to give patients. It upregulated their immune system. And in my patients that had cancer, that was consistent with melanoma spread to the brain, lung, liver, all of a sudden they're living out beyond 10 years with these newer drugs without disease. So I always tell my patients, you can't close that door because you never know when a new drug comes on the market and we can really change the outcomes.
Well, it sounds like a wonderful addition to the medical field, a wonderful addition to our community, to Baltimore, and to Sinai. So it's very exciting. And we thank you so much for spending time with us. I know you're so busy, Dr. Pallavi Kumar, who's talking today about the brand new Mandy and Dennis Weinman Center building and the really fascinating multidisciplinary approach being practiced there now, open for a couple of weeks now.
Yeah.
So if you are somebody out there who gets a diagnosis, keep this in your mind. It sounds like a wonderful center. Thank you so much, Dr. Kumar, for joining us today.
Thank you so much for having me. I really appreciate it.